Okay, Harjot, what do you have?
Hi, Dr. So, I have a patient, 17-year-old female. She's coming in for a follow-up on her antisocial personality disorder, and then she has two new complaints regarding a bilateral lower extremity rash, as well as some white lesions that she noticed in her mouth.
Okay.
In regard to the antisocial personality disorder, we referred her to counseling. She's seeing a counselor. She's got the resources at school, and she had a school counselor as well, so we're good on that end. In regards to the bilateral
And
lower
then about that, I think I saw her with you last time, and you said she wasn't going to school, so now she is going to school.
yeah, she's going to be starting going to school, so I think we've made some good
That's the
progress.
Okay.
In regards to the bilateral lower extremity rash, she says it just kind of comes and goes. She has some lesions here and there. No pain on the lesions, no itchiness, but just happens on her extremities, and it's coming and going.
All right. How would you describe the rash? Is it macular, papular, vesicular?
So the lesions that she had right now are about 1 to 2 millimeters in size. The annular lesions that are macular, they're not vesicular or papular. They're just macular lesions.
So they're like more flat.
Flat, yeah, and they're erythematous as well.
Okay, all right. So what is your differential diagnosis for that?
So differentials for the lesions include, it could be pityriasis rosacea, it could be atopic dermatitis or eczema. Other things could also be tinea versicolor.
Okay, great.
Yeah.
So if we look at the mind map for skin lesions, you can see, so this particular lesion is tinea versicolor with what you're describing, and this one could be atopic dermatitis. So based upon the complete description, which one is closer to her diagnosis?
I think personally it's a mild form of atopic dermatitis. Just looking at the lesion, it doesn't have the annular kind of raised lesions that you expect for a tinea versicolor infection. So I would call it atopic dermatitis. That's my assessment. And plan-wise, because it's just a mild case for it, I think we should probably just maybe have her apply some Vaseline and then over-the-counter hydrocortisone for lesions that are resistant to treatment with the Vaseline.
Okay, so hydrocortisone is low potency. You think that should be enough?
Yeah.
All right. And then what's the third complaint?
So the other complaint was the lesions in her mouth. So she's had a dry cough along with kind of just like difficulty, like a dry throat associated with the lesions. Looking into mouth physical exam wise, it looks like there's vesicular white colored lesions on the left tonsil.
Tonsil or it's palate or gum?
Kind of, yeah, the palatal gum tonsil.
And then the most important question is the duration.
Yeah.
So how long
it's been about 3 to 5 days or so.
Okay,
yeah.
all right.
So differentials for that, it could be diphtheria. However, she denied any asystemic symptoms like fever, chills, nausea, vomiting, so that's less likely.
She's vaccinated.
Could be strep throat, but her Centaur criteria is really low, 0 points, so it can't.
Oh,
I don't
good.
think so.
Good, you mentioned Centaur criteria.
Yeah, so less likely to be strep throat. It could be a URI, or it could be herpes lesions. She did say that she gets some herpetic lesions on the outside of the lip, so it could be just a continuation, a recurrence. Herpes.
All right. So based upon the mind map so we can look at this mind map for the lesions in her mouth. So do you think, well, diphtheria is probably kind of out of the picture, but then between URI and herpes lesions, which one does it more closely resemble?
It resembles herpes most closely, yeah.
Because of the type of the lesions?
Yes.
Okay. All right, and also given the past history. Okay, so what is your plan for that?
So my plan will be to test her first for HSV2, HSV1 and 2, which is a blood test, and look at the titers.
Would you do IgM or IgG?
I would do IgM first.
Yeah, because 75% of the population is positive with IgG.
For a chronic infection, yeah. And then probably give her a Valtrex 1 gram TID for a 7-day course.
Okay, great.
And then
good job.
Follow up in a week.
Okay, so that's what I was going to ask, if you will follow up. So follow up for her rash and this and all three problems. Okay.
Yeah.
And how would you bill for this?
This will be a 99214 because we addressed 3 problems. And we did some medication reconciliation as well.
And you did some labs.
And some labs as well.
It's a little bit higher complexity. Yeah. Okay, that's great. And so which means I need to go see her and talk to her. Okay, which I was going to do anyway to congratulate her. Okay, great. Thank you so much.
Thank you.
Yeah.